what most of us care the most about is what you experience, what you face day to day with, in this context, kids, but in other contexts, adults with, just terrible problems who, if they're lucky, they have Medicaid coverage, and if they're lucky, they can get services, but any of the non-Medicaid covered services or people not on Medicaid, it's waiting lists for, or just told go away. So we know that our hospitals are being besieged. Already we have very short lengths of stay, and you can't get people out fast enough, and then there's 5 waiting to come in, emergency rooms. I mean, all of what we know about, the murder-suicides, all of that. I guess in terms of responding to, what happens next at the state and national level, our hope is that healthcare reform will pass and that it will be integrated, mental health will be integrated, or behavioral health will be integrated with the physical health. We have, every reason to believe that all of the people who now are looking for services will end up with coverage when that finally happens. I think but all the predictions are not till 2014. Hopefully if then, we'll have that. So what do we do for the next 4 years with people in so much trouble? I don't think it's anything magical. I think it's the same kind of thing we've always talked about, which is get us all on the same page, all speaking to our, our elected representatives together. I know that the First Lady and DeAngela Saucer-Short were around the state visiting every county's Child and Family First Council, and I'm quite clear that what kept coming up as one of the top couple of items on the list of issues that were raised was mental health services, access to mental health and AOD services. So, I think as a whole community, we can't let that just drop. We need to take that kind of data, and we need to all be carrying that to our elected representatives and saying, let's make something happen with this. The mental health system alone can't carry the mental health services. It's got to be with these partnerships and sort of transforming how school environments prevent further trauma or prevent distress for kids, and actually build resilience. So I think, it sounds like you're all really totally on the right track, and we just need to stay together, over the next few years until things do get better.
Sure.